In the next few minutes, I'm going to share some thoughts on the technological advances in corneal cross-linking that have occurred over the last 15 years or so. In the US, we received approval from the FDA for keratoconus and for corneal ectasia following refractive surgery about 2 years ago. Some of the products and some of the treatments I'm going to be discussing are not yet in clinical studies and are available outside the US. If you think of how corneal cross-linking occurs, it's really a chemical reaction that includes riboflavin, which is vitamin B2, oxygen, and then UV light. Traditionally, this has been applied in what's called the Dresden protocol, 30 minutes of a soak with riboflavin, and then 30 minutes of the UV light. So over the last 15 years or so, since this originally developed, we've seen significant advances. Accelerated cross-linking, which allows treatment to occur at a faster rate because it's using a higher power device. This may cause less depth of treatment, but that may be appropriate in some patients, especially those with thinner corneas. We've seen treatments that are with different formulations of riboflavin. We've seen treatments that are pulsed because that allows oxygen to recover, and that's part of the reaction that's very important to the treatment. And then now we're starting to see epithelium on treatments. This can occur because we are hopefully going to have formulations of riboflavin that can penetrate the epithelium better. We also understand the role of oxygen, and having supplemental oxygen may allow better treatment. And finally, again, using pulsed and higher energy treatment is a part of that. So that clinical trial is beginning in the US. It's going to be held to the same standard as epi-off treatments to determine its efficacy and to determine whether it can be ultimately something that we can offer to patients, because that would allow patients to hopefully have less side effects because there is no epithelial removal. Finally, the other advances that are occurring in cross-linking are related to refractive surgery. Pixel, photorefractive intrastromal cross-linking, is a way of treating the cornea and flattening it or steepening it depending on whether myopia or hyperopia is being treated. So this may be something that's useful for presbyopic patients. So in summary, we've seen cross-linking come a long way in the last 15 or so years. We're starting to see the benefits in our patients because they are now having less need for corneal transplants in literature across the world when they have keratoconus. And obviously that's a huge benefit for our patients. We're starting to see adoption of this from corneal surgeons all across the world, and now also in the US since we have it available. And certainly there's hope that we will continue to see further developments as well. Thank you very much.